A very warm welcome to you all. So today we will be talking about acute and chronic osteomyelitis. Acute and chronic osteomyelitis. So the most important thing that we have to understand is what is osteomyelitis. What is osteomyelitis? Okay. Osteo means bone, myel means marrow, and itis means inflammation. So osteomyelitis is the inflammation of the bone and bone marrow. Okay. So whenever we talk about osteomyelitis, the most important thing that we need to think of is the causative organism. So the causative organism is actually Staph aureus. It is actually Staph aureus, but it is different in different scenario. For example, in the case of IV drug abusers, it is Pseudomonas. In the IV drug abuser, it is Pseudomonas. Okay. In the case of human bite, it is Echinella. Okay. In the case of someone who is having a salmonella, someone who is having a sickle cell anemia, in those cases salmonella becomes the organism. Remember, osteomyelitis is always metaphyseal. It is always metaphyseal, but in case of salmonella induced osteomyelitis, it is always diaphyseal. Okay, so this is an MCQ question. Next, you need to understand that whenever there is osteomyelitis, what is the thing that we have to remember? There, I already told you, it is acute, it is chronic. Okay, but there is something which is in between that is known as subacute. So less than 2 weeks, it's actually acute. 2 weeks to 4 weeks, it is actually subacute, and more than 4 weeks, it's actually chronic. So this was actually given by World Vogel. Okay, so this is actually known as World Vogel classification of osteomyelitis. 2 weeks, less than 2 weeks, 2 weeks to 2 weeks to 4 weeks, and more than 4 weeks. Usually, whenever we talk about chronic conditions, we say it on the basis of months. Like in the case of acute otitis media, it's only 3 weeks, and chronic, it's 3 months. So we say in this way, but here it's only weeks. Okay, just remember this. You might be confused here. In the case of children, Haemophilus organism Haemophilus may also be involved in the cases of osteomyelitis. Okay, so what is the major difference between having an acute osteomyelitis or having chronic osteomyelitis? Acute osteomyelitis is acute infection. Here, in the metaphyseal region, there is a infection or inflammation focus, and that only exists into the metaphyseal region. No other explain. Metaphyseal region, and there is just a formation of pus, an abscess. Okay, but in the case of chronic osteomyelitis, along with this abscess formation causes a pressurized effect in the surrounding bone that leads to lack of blood supply. Which eventually leads to formation of dead piece of bone, and that dead piece of bone is known as a sequestrum, which is actually surrounded by a new piece of bone which is known as involucrum. Involucrum is nothing but it is actually a series of chronic inflammation which is followed by repair, where there is a thin sleeve of bone. So there is a thin sleeve of bone surrounding this sequestrum. It's actually a component of a repair in the case of chronic osteomyelitis. Okay, so in this thin piece of bone, what happens is the sequestrum, they tend to pierce. Okay, the pus cells, they tend to pierce here. This is known as cloaca. So that is actually a piercing in the new piece of bone, and there is a formation of a draining sinus through which it opens into the skin surface. And in the skin, what happens is there will be excoriation. There will be bony fleckins, and puckering of skin. The hallmark for chronic osteomyelitis is actually discharging sinus. But the hallmark of acute osteomyelitis is the presence of an abscess. But this abscess, since it's not visible, so clinically we just say it as a fever. Okay, so this was on general what we need to understand. So route of spread. So whenever we talk about the route of spread, it is hematogenous. In most of the cases. any blood infection can actually lead to osteomyelitis. One more thing I want to add upon, why only in the metaphysis? Metaphysis consists of hairpin loop of bends. Okay, so it consists of a hairpin loop of bends like this. So these hairpin loop of bends, whenever some of the bacteria affects here, suppose the bacteria has affected here, there will be, the bacteria will move like this. On contrary, if it's affecting the cortex, the bacteria will move like this. So from this part to directly to this part, but here the bacteria will move in the same path like a roller coaster, same way like this. So here there will be stagnancy of blood flow, because of which there will be higher chances of infection. One more thing that you need to remember is there is less amount of macrophages and monocytes in this region. There's less macrophages and monocytes in this region, because of this there will be damage. There will be sequestrum. Are we clear till here? I think we are clear till here. Moreover, this is the clearest, simplest explanation of acute and chronic osteomyelitis. The thing that you need to now remember is what on X-ray investigation. So I'll be talking about on two background. One is investigation, other one is X-ray. So investigation, if you just see in the case of investigation, X-ray, MRI and examination. Okay, so investigation, what can you do for investigation? For investigation you can always go for an X-ray. So in X-ray what you will see is, like if it's only case of 24 hours, around 24 hours, you will just see a shadow, a bone shadow. But 24 to 48 hours, it even may take 2 to 3 days, but after 7 to 10 days you will see some sort of periosteal reaction. Okay, like this periosteal reaction, to prevent the seeding of the. But in the case of chronic osteomyelitis, if you see an X-ray, you will see a dead, dense and sclerotic bone. So this actually looks very white. Okay, actually chronic osteomyelitis, it's a dead, dense and sclerotic bone which is surrounded by a granulation tissue. But this is actually a histopathological diagnosis. In the case of radiological diagnosis, you will just see a dead piece of bone which is sclerotic, which is very, very white. Okay. Now for MRI, in the case of acute osteomyelitis, you will see marrow edema. Like this, total all edema. Clear till here? Now, 1-2 more things I would like to add upon. So what I would like to add upon is, so patient will present with pseudoparalysis seen in septic arthritis, scurvy and osteomyelitis. So what is this pseudoparalysis? That is, the child will not move his leg, or the person will not move his leg because of excess pain. Okay, in chronic osteomyelitis, I already told you that discharging signs is the feature, is the hallmark, right? And the patients, if you just go for an X-ray, you will see a dead and sclerotic bone. What you will see in MRI, you will just see a very, very dead piece of bone. You will see that new piece of bone also still. Okay, that pattern in chronic osteomyelitis. You can see cloaca also. You can see involucrum also. You can see that there's a tract also being formed. You can see well in MRI. Okay. So serum procalcitonin is raised in the case of, that might be either septic arthritis or that might be either osteomyelitis. Okay, in both cases, but more raised in the case of acute osteomyelitis. In the case of chronic osteomyelitis also, acute exacerbations of chronic osteomyelitis, it's raised. So what will be the treatment? How can you treat the condition? So what's our major aim? So let's talk about in the case of acute osteomyelitis. My major aim, my major motto is to remove this abscess. Now if there is new piece of bone formation, there is sequestrum, that's already a chronic osteomyelitis and it has a other thing. Okay, so if it's just less than 24 hours, then just you can give an antibiotics, because that abscess has not become so big. Okay, it's just a small foci of abscess which will actually go away with antibiotics, with heavy antibiotics. Heavy antibiotics means total of 6 weeks you will give, IV 2 weeks, 4 weeks oral. Okay, but in the case of more than 24 hours, you have to drain the abscess. You have to open and drain the abscess. So when you open and drain the abscess, surgically drain the abscess, you need to be very clear, because if that abscess eventually, if it falls under your soft tissues or if it falls under the bone, that might lead to various problems. Okay, so careful evaluation must be done. My first intention is to remove the abscess. Second intention is to make the bone clear of infection. Third, my motto will be to prevent the recurrence. To prevent the recurrence, this 4-week oral antibiotics, this is given, and it's better to remove the abscess under antibiotic cover. Okay, under antibiotic cover, if you remove the abscess. And poor prognostic factor, what can I do the poor prognostic factor? So if the person is diabetic, if the person is a child, if it's immunocompromised, okay, there's a poor prognostic factor. Okay, so I think much more in a nutshell, this is the thing. Flucloxacillin and cefotaxime is the choice of drug. Just remember the name, flucloxacillin and cefotaxime. Why flucloxacillin? Because it's a penicillin, highly effective under staph. Okay, highly effective under staph. So if it's a case of resistant staph, give vancomycin. But whenever you give vancomycin, red man syndrome becomes one of the complication. Now, whenever we talk about chronic osteomyelitis, in chronic osteomyelitis, how will I treat? Totally surgical treatment. Okay, no use of, the aim is same, but the surgery is totally surgical treatment you will do. And surgically, how will you do is, you will actually do sequestrectomy. That means you will remove the sequestrum. You will go for saucerization. Saucerization means you will make a wide open mouth cavity. Okay, don't make the cavity like this. If you make the cavity like this, deep cavity, there might be infection. But wide mouth cavity, infection will seed out like this. And you will go for thorough washout. Wash out everything with normal saline, with this whatever, maybe it might reach 2-3 liters of saline. Just wash out everything and clear the debris, in such a way that until and unless you see small spots of bleeding. And these small spots of bleeding, after you clear, this is known as paprika sign. Okay, so I think this was all, and some more I would like to add upon. So here you need to later keep a bone graft. Okay, here you need to keep a bone graft. Now what you will see in X-ray in case of chronic osteomyelitis. Okay, I will repeat this video from the next component. Okay, from the next video I'll just repeat this.